So thank you for attending COHC's virtual parent education sessions. If you haven't signed in, please sign in so we have your information. And the sessions have officially started. So my name is Elaine Vivens. I'm the coordinator for the Children's Oral Health Coalition. I want to welcome you and say thank you again. We are excited to have you here to be a part of this conversation for today. There are a few things that I do want to go over. One of them is our photo video disclosure. Please be aware that this session will be recorded and made available through website social media links to inform and educate the public on this topic. If you choose to participate in an identifiable way, you acknowledge that your image and/or name will be recorded and are authorizing the use of your information on the recording as described. You have no obligation to appear or speak in the recording, even though we would love for you to because we want you to ask questions. You can turn off your video and participate under an alias should you wish to remain anonymous. I want to give you just a little bit information and say again, thank you for being a part of this session. And again, for those of you that just are signing in, I am Elaine Vivens, the coordinator for the Children's Oral Health Coalition. And we are excited to share our first virtual parent education series with you on growing healthy kids from pregnancy and beyond, what nobody tells you. These sessions are a unique opportunity for new and experienced parents to grow skills and awareness about a kid's oral health, overall health, and well-being. Raising kids is not easy, and they don't come with instructions. We want to help parents by providing access to tools, community resources, topics, and providers around different and difficult conversations as you navigate parenthood. The information we are sharing throughout the series is good for anyone that is supporting parents to help kids grow up healthy and safe. Today's session is the first of our 6 series, and it is on medical and dental coverage during pregnancy and beyond. We have a dynamic group of panelists who will discuss the different types of insurance plans, what is covered, key questions to ask your medical or dental provider, and they'll also share some of their service areas. Before introducing you to our moderator and panelists, I want to share some brief information about the Children's Oral Health Coalition and what it is that we do. So the Children's Oral Health Coalition has been around since 1999, and we are tasked with improving the oral health of children in Tarrant County through community collaboration. Our target audience and population that we are striving to serve is birth through 3rd grade children in Tarrant County and the surrounding areas. And we also do outreach to pregnant teens and women and dads. The work of the coalition is a team effort to accomplish with the help of the 50 members who represent cross-sector of the community. Each member contributes in their own unique way in our impact areas, which is awareness, prevention, education, and advocacy. And I will share briefly just a few things that we do in each of those areas. In the area of awareness, we give out free resources like our dental brochure, slim cards like what you see there with Water First for Quench Your Thirst. These are available at free and no charge to families and organizations that serve families. We also provide education through our Train the Trainer, where we train community professionals. And once they go through our training, they then become what we call oral health ambassadors, because they now go out to help us raise awareness and through education that they do with the parents they serve. And then we also give out what we call prevention kits. They're oral health kits, and we give them out for infants, toddlers, and youth kits. Everyone attending today, if you have children, you will be given oral health kits to give to your children. They include, with the exception of the infant kit, age-appropriate toothbrush, toothpaste, the different materials that you see on the screen, and we will also, in the youth kit, they will get a mouth rinse. In the infant kit, it's a washcloth, an adult toothbrush, toothpaste, floss, and mouth rinse. And that's because we're trying to reach that mom and get her oral health taken care of. When it comes to legislative advocacy, we're advocating for children starting at the organizational level where change begins. And we work with a lot of different organizations to connect oral health, the overall health and well-being of both the parents and the kids, starting at pregnancy. And it's important to have these conversations with parents, especially as we're trying to encourage more access to care through the coordination of the medical and the dental providers. And we're also looking at the access to coverage, because all the work we're doing with working with the organizations, if they don't have coverage, and that's part of what we're talking about today, is the insurance coverage, because that's a huge piece to the access to care. And the data that we collect in the work that we do helps inform our decisions around the type of projects that we do. Having said all of that, we also have another program called the Coordinated Care for Pregnant Teens and Women. And in this program, we do outreach with medical and dental providers. We do dental screenings that we provide either in a school setting or in a community setting. There's oral health education, like what we're doing tonight, that we do to reach out to those pregnant teens, women, parents in general. And we will be doing eventually a campaign around promoting the age 1 dental visit. So let me introduce you to our, oh, wait, hold on. I have so much stuff over here. I want to take a minute to introduce you all to Marissa Navarro. She is our moderator for the evening. She's with Maximus, and she will share a little bit more about herself here in just a minute, but I also wanted to recognize our panelists. Blanca Rodriguez is with the Children's Health Plan. We have Lydia Anderson, who's with Aetna. Lydia Bell is with Amer Group. Brenda Oliveras is with DentaQuest, and we have Christy Ruton with United Healthcare Dental. And I want to say a big thank you to all of to the moderator and our panelists, and to our participants that have joined us today, to say thank you for giving your time and sharing your expertise and knowledge with us today. And on that note, I am now going to turn you over to Miss Marissa.
So thank you so much, Elaine, for allowing me to be a part of this parent education series about insurance. Just to explain a little bit about Maximus. Maximus is an agency contracted by the Health and Human Service Commission. We are the enrollment broker for the state. The role of the enrollment broker is to educate people who've applied for Medicaid about the managed care programs, and to also educate Medicaid recipients about the Texas Health Steps benefits their children will receive and how to use them and how to keep their benefits. The enrollment broker also helps with plan changes when needed and provides support during and after the enrollment process. So in Texas, there's 5 different types of Medicaid. So if you think of Medicaid, think of it as an umbrella. And then there's different types of Medicaid that one could qualify for. So there's the STAR program. There's also STAR Plus. There's STAR Kids, STAR Health, and then there's also the traditional Medicaid, also known as fee-for-service. So the fee-for-service, typically whenever somebody applies for Medicaid and they get approved, they do start off on traditional, which is fee-for-service. That's where they see a provider, and then that provider will be the one to bill the Medicaid directly. And that will last with the STAR program about 15 days, and that gives us, as the enrollment broker, enough time to reach out and help you choose a health plan. And then you'll transition over into whichever medical program, or I'm sorry, Medicaid program you qualify for. So throughout this presentation, you'll hear us use the word MCO, which is the Managed Care Organization. They are the health care company or health plan that is focused on managing care as a model to limit costs while keeping the quality of care high. The type of Medicaid coverage a client gets just depends on where they live and what kind of health issues they have. If a client does not know what type of Medicaid program that they're in, they could always call us at the STAR program. Children in Texas without health insurance may be able to get low cost or free healthcare coverage through either Children's Medicaid or the Children's Health Insurance Program, also known as CHIP. So Children's Medicaid is a healthcare program for children in low-income families. CHIP is a healthcare program for children whose families earn too much to get Medicaid but cannot afford the health insurance, the private health insurance. To get Medicaid or CHIP, a child must be age 18 or younger. In some cases, children with disabilities age 19 to 20 can get Medicaid. They also must be a Texas resident and a U.S. citizen or qualified non-citizen. Whenever a family applies with HHSC, they will ask about family's income to see which programs the child or family can get. And so just to remember, Children's Medicaid is free. If HHSC does find a child can get Children's Medicaid, there is no cost to receive the services. CHIP, on the other hand, fees do vary based on the income. If HHSC finds a child qualified for CHIP, the enrollment fee and co-pays will be based on the family's income. Enrollment fees are about $50 or less per family per year. And they also do have co-pays for doctor visits and medicines range anywhere from $3 to $5 or lower income families for lower income families and $20 to $35 for higher income families. So I just wanted to thank each panelist for joining us today. Each of you will have 5 minutes to share key information about your insurance plan, eligibility requirements, what's covered, and your service area. Participants are encouraged to use the raise hand feature, and I will call on you, or you could also drop questions or comments in the chat box, and Elaine will share those with me. So now that I've given you some basic information about Maximus, the different types of insurance programs, what's covered, and who's eligible, let's talk with each of the managed care organizations, so the health plans, to hear more about their individual plans. We will hear from the medical managed care organizations and then the dental managed care organizations. Our first medical health plan panelist is Blanca Rodriguez. She's with Cook Children's Health Plan. Blanca is a member service lead for Cook Children's Health Plan. Blanca?
Thank you, Marissa. Thank you, everybody, for joining us this evening and allowing us to come to your homes and organizations to speak on this important topic. Cook Children's Health Plan is a local-based nonprofit health organization, which we provide health care under Medicaid, CHIP, and STAR Kids members. We are part of Cook Children's Health Systems as a whole, and we're proud to live here and work with you all here in the community. The service areas that Cook Children's Health Plan does cover are Tarrant County, Denton, Hood, Johnson, Parker, and Wise County. We try to take care of your whole family, and Cook Children's Plan offers quality health care plans for all ages and not just children. The eligibility really is how Marissa just talked about. It is based on income. So we encourage you to apply, and through that, the website you will use is yourtexasbenefits.com. You enter your information, and we encourage you to go ahead and do so. And if you feel that the income that is provided through HHSC is too much or too little, go ahead and still apply. and there's always a chance that the state reviews everything, and if they have any questions, they'll reach out to you. What I will be covering is individual value added benefits, also known as VAS for short. And for our specific health plan, which again, it's Cook Children's Health Plan, we cover extra benefits that these programs provide. And when we say extra benefits, it's specifically to the MCO, and it's everything extra that you're already going to be receiving under the said programs. Under Cook Children's, also known as CCHP, we offer a 24-hour nurse advice line. This is available to you at 24/7, 8 days a week, 7 days a week. And there is a number that you call, and a nurse will get back to you quickly as possible. Also, the benefits, there is a school or sport physical that is covered. It's one school physical that a child can receive. And again, it's through your PCP or also your provider that you wish that to perform that. We have extra vision services. It's $125 for prescription eyeglasses, frames, and lenses, or it's a $75 for contact lenses and fitting fees. In case there is an accident or you lose the glasses or something happens, because we all know that children, it happens to our children. Please feel free to reach out to our member services line, and an advocate will help you in answering some of those questions. Also, we are under our value add benefits, there is a bathtub kneeler. This is a one-time offer for the whole entire family. It helps us to be involved, one, at bath time with our children, and do not leave them in our bathtubs. And that prevents us from any child drownings that have occurred. So we encourage our parents to go ahead and be focused and ready and spending that quality time for bath time. Also, just for our Star Kids members, we offer the special healthcare needs camps. It's up to $200 per member towards an enrollment of an approved health, a special program through a camp. We have a list. Reach out to our member advocate, or you can always go to our website, which is cookchp.org. In additional, we also have a Healthy Me program, and this really encompasses a more of taking your kiddos to the doctor for physicals and all your appointments that are needed. So it's the $15 gift card for members who complete a Texas Health Step checkup at 2 weeks, 2 months, 4 months, 6 months, 9, 12, 15 months, and 18 months. In addition, our members can get a $25 gift card for those Texas Health Steps that were mentioned earlier. We really encourage you to do those. For our Star member only a member, we have an incentive of $25 for diabetes. There's a diabetes program. We encourage the healthy eating, and a caseworker and a member advocate again will be available when ready to reach out to them and more about this information. And for our pregnant viewers and participants, a gift card of $50 per pregnancy for members. If you sign up for a class, you get it within 42 days after joining our health plan. You get a basic book. The dental service part is up to $350 for basic and major dental services. And so we encourage you to take this opportunity and visit your local provider, your dentist, to make sure you get those check-ins during your time as you're pregnant. And of course, we offer the childbirth classes. And if you had any questions in regards to these value-added benefits, we're always available Monday through Friday, 8 to 5. Um, and again, you can reach out to us at 1-800-964-2247, or all the information that we talked about today is available specifically to Cook. It's at cookchp.org. And we just encourage you to ask questions, especially to our members, or if you're not a member of ours, we'll be happy to answer any questions related to our information, and just reach out to us when available. Thank you for this time, and it's back to you, Marissa.
Thank you so much, Blanca, for providing that overview of Cook Children's Health Plan. I do have a follow-up question for you. This is regarding the value-added services that you discussed. Will these services will the families automatically get these value-added services, or is this something that they need to call in advance to take advantage of, or how do they participate in these value-added services?
Once a family has chosen a medical and a dental provider, they are automatically our member. So that is to them instantly. They will receive a welcome packet on behalf of our health plan. And in the packet, there will be a member booklet also available on our website. And it'll give age specific how-tos to access everything from our website to our portal to renewing cards, even to submitting information possibly relating to birthing classes and getting their books and things like that. So all these benefits are available to them as soon as they choose a health plan, specifically to our health plan as Cook Children's Health Plan.
Okay, thank you so much for that. Next, we have Leatrice Anderson with Aetna. Leatrice?
I am officially Latress Spencer now, but I still use Anderson as well, so people can get used to the change. I am a community outreach specialist for Aetna Better Health, who is now actually work with CVS, but we still consider Aetna. And what we're doing right now is we're officially back in the field, so we hopefully will be able to do more face-to-face meetings like this with our members. Our service areas are the same as Cook. We do the Tarrant, we do Hood, Johnson, Parker, and Wise County. And we've been really trying to outreach to some of our surrounding counties because it just seems to be a lot of presence there. So since we've been out in the field, I've been trying to reach out to more Denton and Parker. But we also have value-added services as well. Some of them are similar to what Cooks have, and you probably will hear a lot of repetition on all the value-added services. But our goal is outreach on any plan, and I think I can honestly say this. When we run into anyone that's not our member, we know each other enough to kind of guide them to Amer Group or Cooks. And because that way, instead of them having to call in, if we know someone that's already a rep, we're pretty good about reaching out and helping each other. We do have over-the-counter $25 a month that our members get for over-the-counter medication strictly through CVS, and that reactivates every month. Is $25, and those are items that the whole family can use. And like I said, we probably have pretty much the same value-added services. Some stand out a little more than others. We do have the sports physicals. We all encourage the Texas Health Step. We can help you with making appointments, assisting with transportation, which something different is going on with transportation. I'm still trying to figure that out. But if someone needs that type of assistance, they can reach out to me and we can guide them and figure that out together. So that's the only thing different with with Aetna as far as the transportation. We're still trying to figure out exactly how all that's going to be working for our members. We also, for our pregnant members, we have a promise program. And basically what that is, once you do all of your prenatal visits and your postpartum visits, we give you $50 worth of baby items such as diapers, washes, and just different things that can help you with the baby as well. And then we also offer extra help for our pregnant moms, like if they need like cell phone, we have a cell phone service assurance that we can help them with if they don't have a cell phone. But I think everyone at this point has a cell phone, but we do offer that. We have our 24-hour nurse line, and we also, which is 7 days, 24 hours a day. So we also have that. And then we also have health and wellness services. We also have weight management programs we can help the families with. So our whole goal is just trying to encourage the health, not only focus on the children, but help the parents as well. And I know we work closely with, Aunt Bertha. We get other resources for families. We try and help them with other resources. And our goal is to try and meet our members and to reach out to our members, but it don't stop there. If we see there's a need and we know of a resource that can help the families, we all are really active on knowing what's going on in the community and who can help you with different things. So we definitely try to help with just more of the Medicaid, but Aetna is real big on fitness. So we do health education for children, and we do it in schools and parent nights in schools. And we also do different type of like fall festivals. We'll do parent night or whatever your church or your community may be having. So if that's something you're interested in us coming out to do, you can reach out to our 800 line and just say you want to link up with outreach and try and set up something for us to come out to your church or your child's school. And we're very active in the community. So we're actually, I'm sure, all looking forward to being out of the office because we've been in for over a year. So we're excited to jump on any events we can because we need to be visible. We like for people to know us in the community, and because it's a big thing in Tarrant is trust. And once people get familiar with you, they feel more comfortable to ask questions, what their family may need. And we're not afraid to say, I don't know that answer, but I will get back to you with that. But that's pretty much it far as Aetna. Medicaid is pretty much Medicaid, and we all offer something separate. When in doubt, you can call our 800 number, which is 800-248-7767. And we have a really big group of what they call member service workers there. And also our website is www.aetnabetterhealth.com/Texas. And it's very user friendly. I go in there about once a week to make sure I can navigate it. So when I'm explaining it to our members, I can give them a step-by-step because sometimes you need someone to actually tell you versus clicking on things. But my information is in the chat box. Please feel free to reach out to me. I'll be more than glad to help you. If I don't know the answers, we'll find it together. Thank you so much for your time.
Thank you, Beatrice, for sharing information on Aetna's health plan. I do have a question for you. So what happens if a child or pregnant person loses their eligibility if they are with Aetna?
But what we'll do is we'll reach out to our member services and see what exactly went wrong. And sometimes it's something as simple as they didn't submit a form or something's missing. And it's usually a quick fix. And if it's not, the member services are there to guide them on what their next, approach may be. Because sometimes the income changed or, they just they don't want to submit the paperwork, but they don't just say, okay, you're on your own. They will try to find other resources to help the family until they can get it all figured out.
Perfect. Thank you so much.
Thank you.
Next we will have Lydia Bell. She's community relations representative with the Amer Group. Lydia.
Okay, yes. Thank you, Marissa, and good evening to everybody. I want to thank Elaine for having us all be a part of this wonderful panel. As Latress said, we're so excited to be able to present for you guys to provide you all with information that's going to be beneficial for you and your families. So I do have a short PowerPoint to share with everybody. There we go. And we're going to go ahead and jump to the next slide, please. So just a little background on who Amer Group is. Amer Group was established in 1994, which means that we've been serving Texas proudly for more than 20 years now. We do have over 900,000 members in Texas under Star Chip, Star Kids, and our Star Plus products. One thing that I did not include on that slide is the Tarrant service delivery area, which are the areas that we currently have our products. That's going to be Tarrant County, Johnson, Hood, Wise, Denton, and Parker. So this next slide, we're just going to go over some coverage for our expectant mothers. Of course, our benefits are designed to make a difference in you and your family's lives and to make things as easy as possible for you. Here are services offered by Amer Group for expecting mothers through a Medicaid and CHIP perinatal program. One of the benefits that we have is going to be access to a network of doctors and hospitals nearby. Again, we want to make sure that you're as comfortable as possible and make things within close proximity to you and your family. Access to perinatal specialists when referred by your perinatal care doctor. There's going to be prescriptions and prenatal vitamins. We're covering labor and delivery, as well as postpartum visits for the mother after the baby is born. We're also going to cover regular checkups, prescriptions, and immunizations for the baby after the baby is born. So as my counterparts covered prior to my presentation, these are just going to be some extra benefits that Amer Group members get. These are, as they refer to, value-added services, okay? So one of the benefits is going to be the 24-hour nurse helpline, where nurses are available to our members 24 hours a day, 7 days a week for any healthcare questions that you might have. If you wake up in the middle of the night and your 3-month-old is running a fever, he or she may be coughing, they may not be eating like they typically do, you can always call the nurse helpline at any time of day or night. They're going to basically walk you through the steps on how to keep your baby comfortable until you take them to the doctor or are able to take them to the provider the very next day. Okay, we also have free cell phones with our smartphones through the Lifeline program with monthly minutes, data, and texts. And we also host educational events and health education programs close to you on childbirth, infant care, parenting, and pregnancy. And if these aren't classes that we're specifically hosting, we can definitely find some resources that are hosting these classes in your area. And just a friendly reminder, all of these benefits and services are available to at no cost to you. Continued coverage for newborns. The benefits a newborn gets will depend on the family's income, as we went over earlier. If income is at or below the income eligibility requirements for Medicaid, the newborn will be moved to Medicaid and receive 12 months of Medicaid benefits starting at the date of birth, or if the unborn child is in a family with income above the income eligibility for Medicaid, then their benefits will continue through the CHIP perinatal program as a CHIP perinatal newborn. And what that basically means is, as the ladies explained earlier, if you guys remember, with CHIP, there's just some costs associated with some of the medical coverage and prescriptions, okay? And this is just information on how to find out more about your benefits, services, and providers. You can always access our website at www.myamergroup.com/tx. There's our Amer Group member services number at 800-600-4441. There's an awesome team of member services representatives that are available to assist you Monday through Friday from 7 a.m. to 6 p.m. Central Standard Time. You can also go to yourtexasbenefits.com, which is another awesome resource that I recommend just to find out any information about your benefits. If you need any updates on renewal, anything of that sort, that's going to be your best bet, okay? And for StarChip eligibility questions, you can always call 800-964-2777. And then we also have two more resources here listed on this slide. It's going to be HHSC and Espanol. That's just hhs.texas.gov/ES. And then we also have information on the adoption assistance or permanency care assistance. Okay. And here's all of my information available to you all. Once again, my name is Lydia Bell. I'm a community relations representative with Amer Group. You can always give me a call on my cell phone at 682-206-9857, or I'm always available to you via email at lydia.bell@amergroup.com. That information is all listed also in our chat box. And also, if you guys ever, like I said, if you have any questions, please feel free to call me or the member services number at any time. Just to let you guys know that our services don't stop at just what we do as a health plan. But as Latress mentioned, if you all ever need any type of resources for food, education, housing, things of that sort, we're also available to you to connect you with any other community resources. And we also have a community resource link that's a wonderful resource to our members that you can use via the My Amer Group TX website. And with that being said, if nobody has any questions for me or any questions out there, then that concludes my portion of the presentation. And once again, thank you so much for your time.
Well, thank you so much, Lydia, for sharing information on Amer Group.
You're welcome.
One question I do have for you.
Yes, ma'am.
Can members change their, first, how can someone find a provider on Amer Group's plan?
Okay, so you would just go to the website that I mentioned. It's just www.myamergroup.com/TX. On that homepage, there is going to be a box that says find a doctor. So our members can click on that box. And then from there, you can actually search for providers by zip code. You can search by specialty. If there's a doctor that you work with or had worked with in the past or work with currently, you can also search by that provider's name as well.
Okay. And so can members change their primary care doctors? And if so, is there a limit to how many times they can switch providers?
So members are allowed to change providers at any given moment. Typically when I'm doing my presentations or when I'm doing member phone calls, which is what we've been doing a lot of the time since the pandemic, we do make sure that we educate our members and let them know that they're not stuck with any one provider, they're not stuck with any one specialist, that they can switch providers at any time while they're covered under Amer Group, okay? I think sometimes there's been some misinformation with that in the community. I think sometimes we've even had some providers that may not necessarily know about that. So people do think that they're stuck with one provider or another, but definitely making sure that our members do know that you can switch providers at any time. You can either go to our website or you can call the member services number.
Perfect. Thank you so much.
Thank you, guys.
Thank you. So we will now transition to one of the three dental MCOs in Texas. I have Brenda Olivares. She's a member service specialist at DentaQuest. Brenda.
Hi, good evening. My name is Brenda Olivares. I'm a member advocate specialist for DentaQuest. Thank you for allowing us to share this time to speak to you a little bit about our services that we offer and kind of show you a little bit about what we do. So DentaQuest, we cover the whole state of Texas. We are one of the 3 dental plans in Texas. And my area that I cover, the service area that I cover, is Region 2, Region 3. So without me just saying service Region 2 and Region 3 without showing you, I'm going to show you a little bit so that you are aware. So I'm going to take you on a little road trip to my website. Give me 1 second so that I can do that here. All right. So hopefully you're able to see my website. Let me just kind of move this over here. Okay, so Region 2, Region 3. So if we're looking at this, you can see Region 3 is the Tarrant area, service area, the Dallas Fort Worth area. Region 2 would be on the other side where Abilene and Wichita falls. So this is the coverage, and I am the representative for these particular 2 areas. With that being said, I do want you to understand with DentaQuest the importance of knowing your benefits. Some of the misconceptions that we do have with the dental program is that most parents believe that dental is covered under medical health plans, and that's not necessarily true. So for children that either have Medicaid or CHIP, they do have a separate plan, and that would be their dental. It depends on which one they have actually selected. And that is the one that's going to be able to help with coverage. So the reason why I brought you to our website, dentaquest.com/Texas, so that you can understand how to view your benefits if you do have a child with Medicaid or CHIP, and to see the benefits and coverage for that. So once you're on our website, you can see here, there's several little icons. Secure member website, we can discuss that here a little bit further, but member benefits really is what I'd like for you to look at. So when you click on Medicaid benefits, it tells you the benefits that are covered under Medicaid for the children that have that particular coverage. And you can also look at our CHIP benefits. You can see the coverage for that. Now, we're wanting to talk about some of our value-added benefits. When you go under the icon 1, 2, 3 over extra benefits, you're going to see our value-added services. If you visited our website in the past, it has all changed. So it's a little new, and the reason why I want to navigate with you so that you can understand it. If you do have DentaQuest, we do offer a free dental care kit for child and parent. It is within the first 90 days upon enrollment, you would receive a zippered backpack dental kit that includes toothbrush, toothpaste, brushing chart, and stickers. And the parent would receive a spinning toothbrush, timer, and floss, because we do encourage parents and children to brush together so that you can get that modeling going on. The way you would receive this, if you click on here, it automatically highlights the Medicaid button or the CHIP button. So depending on which one you have, you would just click on it and it would automatically take you to the page that you would have to fill out to receive this particular value-added service gift. And so if you go down here, we do offer a $20 Walmart gift card for preventative visits. And so this is an annual $20 Walmart gift card. And these are the appropriate covered preventative care. And so if you look at the guidelines, it's 6 months to 35 months, and it would be a dental checkup. So if you've done that within the first 6 months and up to 35 months, you would be able to go in here and receive that $20 Walmart gift card, depending whether you have Medicaid or CHIP. We do have here, it says applies only to Medicaid members. For CHIP members, it's 15 to 18 years old. So just kind of keep in mind that there is a cutoff here under 15 to 20. That's actually for Medicaid, and it's 15 to 18 for CHIP members. So just kind of keep in mind that there is a little bit of a difference, but each one, once you move up to each tier, the treatment for preventative care changes. So 36 to 5 years, we're looking for the topical fluoride treatment. 6 years to 9 years, the first molar sealed. 10 to 14, second molar sealed. And then 15 to 20 for Medicaid would be the 2 teeth cleanings. And then for CHIP would be 15 to 18 teeth cleanings. Again, so here are the 2 icons that you would click on in order to fill that out so that you could receive that value added service gift. And then we do have our online member portal for those that are members of DentaQuest. Only members of DentaQuest. We do have our member portal. We are encouraging our members to utilize this portal so that you can print out your ID card, change your dentist, find a specialist, and chat with us online. And when you do that, and if you've done that after September the 1st, you would receive a $10 Walmart gift card for each child that you've registered onto the member portal. So let's say that you have 4 kids, they're all on DentaQuest, and you've registered all on their member portal, and it was after September the 1st of 2020, you would be able to receive $10 gift card per child. Now, it is a reward that's only available first time for your registry, per lifetime per member. So just kind of keep that in mind. This is, again, a reward that you will receive after September the 1st, 2020, if you've registered for your member portal. Again, the service is free. We're just encouraging you to have access to your children's case so that you know how to look up dentists, find a specialist. If you have questions, concerns, that's what the portal is there for. And then lastly, we do have a $10 Walmart gift card after, for a dental visit after an emergency room visit. So we want you to go visit your primary care dentist, your main dentist, 30 days after your emergency room visit for a dental related issue. And we would be able to give you a $10 Walmart gift card once you've taken and filled out the form appropriate to which service you have, whether it's Medicaid or CHIP, but there's also a quiz attached to it. So again, the gift card itself is per member per lifetime. So all of these great value added services are allotted to our members. They're on our website. If you feel like you want to go through and just kind of see which ones apply to you, you're more than welcome to. And I do also want you to see that when you go on here, I'm going to take you back to your dental plan. When you click on Medicaid, you're able to see your Medicaid Handbook. So if you are ever concerned regarding of what are some of your rights as a member, or you want to know if a service is covered, you can actually click on it and it's going to take you to a PDF version of our member handbook. And so when you scroll through that, you can kind of see what all is there for you for our Medicaid members. We also do have that for our CHIP members. And you can see that here. And if you have questions, concerns, again, if you've registered for the member portal, we do have that live chat feature. But if you want to give us a call and chat with us, you're more than welcome to. We would have that information on our page where you can give us a call, and apparently here you could even send us a question as well. And so one thing I do want to tell you, and some of the questions I do receive is, well, how do I find a dentist? So on our website, it would be the first icon. It's find a dentist. And so we're going to just do a little quick simulation as if we're going to the dentist, and we're going to assume that you live in the Diamond Hill area. And so we're going to look for, let's see here. Oh, sorry. So we use this. Yes, this is correct. And for some reason, this is here. We'll do this. Okay, confirm selection. And so you can go under dentist name if you know the dentist that you're currently looking for, by specialist if we're looking for a pediatric dentist. And it would pull up the ones in your area. So you are able to filter by distance, language, if they're accepting new patients, pediatric dentistry, if you're looking for general, and then also if you're wanting a male, a female, and any type of like just specialties. If there's special needs child that needs specific needs, you would be able to filter through there. So again, this is a wonderful tool if you want to be able to look up and see what is around you regarding the dental. So hopefully that's been a little bit of a help to you in navigating our website, knowing a little bit about us. I've been with DentaQuest for about 8 years. I'm a member of the Children's Oral Health Coalition. I am all over the place, and I love doing presentations on oral health. So if you ever see me, please don't be shy. Come up and talk to me. I'd love to share some of my information, or maybe we can talk regarding about maybe things that you've learned. But as always, just appreciative of your time. Thank you for allowing me, and I apologize for my son interrupting, but thank you.
Thank you so much, Brenda, for sharing great information on DentaQuest. Actually, that's exactly why I had to come to my regional office, because I knew my kids would interrupt me. So thank you so much. I have a question for you. What tips could you share to parents if they need help finding a quality, kid-friendly dental provider?
Okay,
what are some
perfect.
tips that you could provide?
Perfect. So I did a presentation in Keller last night for the Pregnancy Help for You. And one thing that we discussed was about putting the emphasis on not just a pediatrician, but looking for your pediatric dentist at an early age. So this is speaking to those mommies who are currently expecting or have a young one at home. You want to be able to start looking as soon as you're pregnant so that you are able to kind of get those questions out of the way. The process in when you look for a pediatrician should be the same when you're looking for a pediatric dentist or a general dentist, whichever one you prefer. Ask yourself, is this where I'm going to want to take my child? Do I feel comfortable? Do I feel like my child is going to have a great time at this location? Are they friendly? Are they responsive? Do they cater to little kids? Those are great questions to ask. And so if you are pregnant, I want you to make sure that you are making that effort and asking those questions beforehand and having a list of dental providers in your area that you would like to investigate a little bit more. It's okay to ask these questions. One thing that many parents don't know is that in the state of Texas, we do have quite a bit of dentists that after 3 years old, you're not allowed to go in the back. Are you comfortable with that? And if you are comfortable with that, then perfect. But if you're not, then you probably need to continue looking for another provider. Because if that is an issue, uprooting them is going to cause some trust issues in that child. So just kind of keep in mind, when you go for that first dental visit at 6 months old, you want to make sure that location is going to possibly be their forever location until they're 18. That's what we're trying to achieve, that they're having that relationship, that they're setting those that relationship with that dentist. Because once we're bouncing them around and changing them around, it's very difficult for a child, especially an anxious child, to develop that relationship with their dentist. I ask you this, how comfortable would you be doing that with your pediatrician? And most of the time, the answer is no, because you want one pediatrician who knows the medical history of your child, who is aware of your child, who will receive your child, who knows their nicknames. That is the same response you want for your pediatric dentist and or general dentist, that they have that same rapport. So I hope that answered your question. And if you don't know and you're wanting to know more, ask your friends, ask your neighbors, anybody with kids, and do Google reviews. Find out, which ones are receiving good reviews, which ones are not. Because surprise, surprise, most parents don't report bad activity in the sense of like if they've been mistreated or if something happened, they won't report it. And so just kind of keep in mind, it's okay to ask all these questions because you are your child's advocate at the end of the day. And I hope that answered your question. Thank you.
That was perfect. Thank you so much, Brenda. Last but not least, we have Christy Rutan, CHW, Clinical Program Manager, Senior Community-Based Coordinator for DFW and Northeast Regions 2 and 3 with United Healthcare Texas Dental. Christy?
Like she said, I'm Christy Round and I'm with United Healthcare Dental. I've been with United Healthcare for 7 years. I've done several sides of United Healthcare. So I have done the kids program on the Medicaid side as well. But starting out, of course, we love to see you smile. United Healthcare, we are one of the newer dental health plans, but we are not new in any form or fashion in medical care or new to caring for our members, as we've been around a very long time in medical and in dental. This is just not a separate dental plan. So we are new as a separate dental plan, but we did get awarded in 2019 for this program. And then we started September of this year during COVID. So we started this year. So it was kind of a start where we had to kind of start from home, but it's really been a great experience, giving us a time to really connect with our members, to be able to talk to our members and give our members the time to really talk to them and answer questions and all the time that they need. United Healthcare is a statewide program, so we are all over the state of Texas. I actually do work for Region 2 and 3, and I'll get to that when we get to the map. But we do serve Medicaid and CHIP dental members. The next slide. Our mission is helping people lead healthier lives by keeping smiles healthy, and we're a trusted name in healthcare. We try and deliver, simple and by trust. We also, partner with our experience from all of our other programs, all across the board from the other health plans, from our medical health plans as well. You can go ahead and move on. I'll just speed it up a little bit. We won't. Our next one, of course, Medicaid is health care coverage for people with low incomes and serves children from 0 to 20, as we covered earlier. So I won't go over this since we covered it early and we're running short on time. So we'll skip on down to the map. And the map is, like, I serve all of Region 3, and then I serve part of Region 2, mainly Wichita, Clay, Montague, Jack, Archer, Young, maybe 1 or 2 other counties in Region 2, but I serve all of Region 3. So if you know of anyone in a different area, please feel free to give them my number and contact information. So next slide. On this slide, this of course is our slide where we have our member-centric and of course provider-centric. But on our member, I wanted to point out a few key positions. One of them, of course, I'm the community-based coordinator, is what we're called on the outside. And we connect people, as I said before, to resources and education. So when we're out there, we aren't just connecting people to dental. We for sure are connecting people. That's why we love to partner with organizations and like this one, because if we're out there helping someone, we don't want to say, listen to a problem and say, sorry, we can't help you. We love to partner with other organizations like the one we're on with, so we can say, we know someone who can help you, and we have a personal contact that we know and we trust that we can give that person to, and they will be, provided for and cared for with someone that we trust, knowing we're going to let that person take care of them. And so we definitely coordinate with other organizations for that reason. We also participate in health fairs, clinic days, migrant farm worker outreach. So if you know anyone that's working in the field that are migrant farm workers and them, we try and get those people in quicker and quickly. So they can actually be seen before they go out. So we definitely expedite that. So we try to identify those members so we can have them come in and be seen quicker. One thing about United Healthcare is, of course, we're all local. So we have, everyone local. It's not someone far away that's trying to serve the members. We're right there in the community, building the relationships with the community, with our members, with the people that they do business with you. We're right there in the community with them, with also. So also the member advocates is the other position I wanted to point out on this slide. And the member advocates are your advocate. So if you're under our plan with United Healthcare, a member advocate, if you're like me and you're not really tech savvy, which I'm not, going on the computer sometimes is overwhelming, and you get on the computer and you're like, oh, just forget it. So to me, if you have a member advocate, you can call, we can give them their number. You can always call me, always email me, but a member advocate is there for you to call, and they can help you find a dentist, but not only a dentist, but if you have any other issues that you're having with your child, or even in your house, or you're trying to find something in the area, they'll help you with that too. It's just not all about dental. So if you jump on the website and you're just overwhelmed, just reach out to the member advocate, or me, and we can certainly get you connected and certainly get you to the place where you need to be. And just in a simple direct phone call as well, where you don't have to dial the 1-800 number and choose about 4 buttons. It's just a direct phone call. So that's always been helpful to a lot of people. So next slide. Okay, I'll go over this really quickly. Value-added services are, and these we're changing up a bit in September. I won't go over the changes today, but what we have, the reward for like the baby teeth program. So you get a $20 gift card for dental supplies, toothbrush, toothpaste, mouthwash, and dental floss. And of course, ages 6 months through 3 years if you go in for your dental visit. And for ages 3 years to 12 years, you get a backpack with a dental care kit, which includes toothbrush, toothpaste, and floss. And then if you're ages 6 through 19, you get a sports mouth guard where you can use to either play sports, or you can also use it at night, like if you grind your teeth or for some other reason. So it's a multi-purpose. And those are very quick going over our value-added services. And I don't know if do I have a next slide? I think maybe my inside. The inside is my contact information, my phone number, and my email. Also, it has our information to reach out to the company. If you ever lose your card, you can always print out your card on the site. There is also, we have our website for people that don't mind the computer and can get on the computer and find their way to find a dentist, find the area that they want, print out a card, all the good things that you can do and find on the computer if you can find your way around that. If not, like I said, you have my email, you have my phone number. Feel free to call me and ask me anything. If I don't know the answer, I'll tell you I don't know the answer, but I'll find someone who does know the answer and get back with you on that. But I appreciate y'all having me here today.
Thank you, Christy, for sharing that information on United Healthcare. Elaine, I'm not sure if I have time to ask questions. If it's okay, I most certainly can.
Let's open it up to the audience to see if they have any
Okay.
questions.
All right, so the floor is now open for other questions. Do any of you have questions for our panelists? Please drop your questions in the chat box or use the hand feature and I will call on you.
while they're thinking about it, Marissa, you can go ahead and ask one.
Okay. So one question I have is for the MCOs, so for medical. So how does a Medicaid recipient receive mental health services, and are referrals required for that?
I'll go ahead and answer that question. These services are brought to you through either calling your case manager is through member services. They'll go ahead and direct you into case management, and upon them assessing for specifically us as cook children, they'll assess the needs and they'll go through our specific company that we work with, which is Beacon, and a representative will reach out to our members and they will start the whole process, and our members go from there. And these services, depending, again, it would be covered under the specific program. So for CHIP, if there's an incurred cost, everything would be given, that information would be given up front to discussion with the caseworker, and that facility, and the member.
Perfect. Thank you so much. And this one's also for the MCOs as well. I have a couple questions for the dental. So what happens if a client receives a bill for covered services? Who should they be contacting, or should they pay that out of pocket? So let's see. What should a parent do if they want to change their dental provider?
If they want to change their dental provider, they can reach out to their health plan, and we can change their dental provider. So just reach out to their health plan. Yeah.
Okay. Well, thank you so much. And is there a limit to how many times they could change their dental provider?
No, they can change their dental provider if they're not happy with it, certainly.
Perfect. Thank you so much. Yeah, so for the MCOs, what happens if a client gets a bill for covered services? Should the parents pay out of pocket, or who should they contact?
With us, they'll contact their member services, and at that point, they'll pull it up in the bill and see what went wrong, and then they'll get together with our claims department, and sometimes they just have to resubmit it. Maybe a code was missing or something like that, but they shouldn't pay out of pocket. Not at all, especially for a covered service.
And to add to that as well, to submit the information as soon as possible. Again, because CHIP and Medicaid are a limited time within an enrollment. So as soon as you get a bill, please turn it in to the health plan. So that way the the advocate can go ahead and help you and assist you, and everything can be taken care of through the claims department and so forth.
Perfect. Let's see, for dental, can you please explain what a first dental home is? Since we spoke about that during the presentation.
So first dental home, that is going to be your child's first dental home, up to, I believe, 35 months. And so that is going to be where you're getting all of the information you need to start your basic oral care journey. It is extremely important that you go to your first dental home. I know a lot of pediatricians tell you that you can go as early as 1. Actually, with Medicaid and CHIP, you can go as early as 6 months in order to find that first dental care home. So if you don't know who that would be, there are some that have registered as first dental care homes. So please call us, let us know, depending on who your dental provider is, we would be able to help you with that in finding a place where you can call home.
Perfect. All right. Do I have time for one more question? Okay, so let me see if I could squeeze this one in. This one would be for the dental MCOs, just to kind of make it even. So are braces covered?
I'll take that one. So braces, there's a misconception regarding braces, that braces are no longer covered. That is not true. Braces are covered. However, it has to be medically necessary in order for you to receive braces. So if you go to an orthodontics and they tell you you need braces, they're going to then send that to your dental insurance. There is x-rays with explanation that goes with that. If you get a denial letter, you do have up to 30 days to appeal that process. If you feel as a parent that you need to appeal that decision, you're more than welcome to do so. But regarding braces, it is medically necessary and it is defined by that. So if you're wanting to know what that is, you're more than welcome to give us a call. We'll be able to walk you through that. But the way that the state looks at it, it is that your child's life is in jeopardy if they do not receive that care.
Perfect. Thank you so much. I have a lot of questions about that. So thank you so much, Brenda. Let's see. Thank you to our great panelists. We have learned some key information to make sure families can access as much needed insurance, as well as finding the medical and dental providers that is a good fit for their families and for their children. Before turning this back to Elaine, I would like to thank each panelist I would like for each panelist to share a piece of advice or information that you didn't get to share earlier to help the parents.
Hi, this is Lydia with Amer Group. I'll go ahead and go first on that. My piece of advice is to make sure that you check your mail. We do send a lot of things, a lot of important information through the mail. One of those items is going to be your member handbook, okay? So once you're an Amer Group member, we're going to send out the member handbook. That's extremely important to go ahead and hold on to that and also to review, because that's going to have important information on your services, what's covered, what's not covered, any frequently asked questions, how to change providers, your value added benefits, important telephone numbers, important websites. So that is my piece of key advice for you all. Thank you.
Thank you.
Hi, this is Christy, and my advice would be if you move to not only change your address with your MCO, but change your address with HHSC as well. That would be my advice.
And if you get denied, don't get discouraged. Always apply or appeal the decision of the state. Or you can reach out to any of us here today. We have our contact information. We can help you through that process. And again, don't get discouraged. Just reapply.
My advice would be, when in doubt, ask.
Yes.
Because it can always direct you accordingly, because you never know till you ask, and a lot of people do not read the information we send out. So if you don't want to go through the book and you have specific questions, just call in. There's someone waiting to answer your questions.
And my piece of advice is, like I said earlier, there is no one else but you as your child's advocate. So if you don't say anything, no one else is going to stand up. So you fight for your child. If you feel that there is maybe a misunderstanding or whatnot, you need to be able to pick up that phone and either call us, call whoever your plan is, and let it be known so that your child gets the best care that they deserve and need. In that, with DentaQuest, one thing I didn't mention is that we're trying to do more of a digital communication. So on our website that I was navigating, we do have a link where you can put your email address where we can communicate via email, if that is easier for you, so that you're not bombarded with a bunch of mail like, just all the time. So just again, you are your child's advocate. Please fight for your child and let us know how we could be of service to you. We're excited to be able to educate you on oral care and walk in this journey with you.
I'm sorry, I had one thing else I just thought of when she said that. We are starting to do text. So if you're one of United Healthcare dental members, if you would like to start receiving text, we're now starting that, and we are making calls to see if you want to opt in for those. Thank you.
Thank you so much for that information. Elaine, back to you.
Thank you. Thank you again to our moderator, Miss Marissa Navarro. You did an excellent job. Bravo. And to our expert panelists for all the great information they've shared this evening. Bravo, and thank you all. And for our participants, thank you for showing up tonight. We really appreciate it. I just want to give a few closing remarks before we go. All participants will receive a door prize, a certificate of completion, and a link to the recorded session. Items will be mailed or emailed, depending on what it is, along with any handouts provided today. And on that note, everybody, again, I want to say thank you so very much to all of you for helping out and being a part of this session today. And you all were very passionate, very engaged. And I apologize that we ran out of time before we could delve in even deeper, but it was really good and we will continue. And I hope to see you at session 2, July the 26th. Thank you all.